Well, junk food ads could be banned and the cost of alcohol and cigarettes may skyrocket under a plan being considered by the government. A long-awaited report by the Preventative Health Taskforce has made more than 100 recommendations, all aimed at making Australians healthier. Joining us now is Professor Rob Moodie, the chair of the National Preventative Health Taskforce. Professor Moodie, thank you for joining us this afternoon. If we can talk first of all about the proposed higher taxes on alcohol, do you think that's going to have any impact on reducing alcohol consumption?
Well, certainly we know from well over 100 studies that there's a direct relationship between price and consumption. We've in fact said we need a bit more work to work out what's exactly the right regime or structure for taxing alcohols, whereby we're trying to, I guess, move towards lower alcohol products to increase their production, their promotion, and make, in a sense, drinking a bit safer for Australians.
You've also proposed a crackdown on alcohol advertising. How far would that go?
Well, what we're saying is that over the next 4 years that we should phase out promotions that are really targeted at young people. Again, the evidence that we're getting about the fact there is a relationship between advertising and how our young people drink. And I guess we're seeing, we have seen over the last number of years, lower ages of kids starting to drink, drinks that are being made and promoted directly at young girls, for example. And we're seeing that actually result in a lot of sort of antisocial, a lot of real problems within the community. And I guess that's what we really start to have to look at to make our drinking culture safer.
Now, also another proposal, of course, the introduction of warning labels on bottles of wine and beer. Do you have any evidence that that kind of thing deters people from drinking?
Well, again, most of these things actually have to come as a sort of comprehensive package on their own. They don't work whether it's around pricing or whether it's around promotions or labelling. It's what goes together. We've seen that, I guess, from our very successful approaches in tobacco over the last 20 years, in road trauma, in HIV prevention, all these areas where we've put public education together with research, we've put it together with community programs, school programs, workplace programs, sensible regulation and pricing and taxation. But just one thing on its own never works.
So as we've said, there's more than 100 recommendations here. It's up to the government whether the measures are adopted. Do you think that's likely? Have you had good feedback from the government?
Well, I think the government's really had a good track record so far. I guess if you look at the amount of money, they put the biggest single amount of money into prevention through the National Partnership on Prevention recently. They're establishing a new National Preventative Health Agency, something in a sense that Australia's been waiting for well over a generation. So we see, this is now the best opportunity we've had in more than a generation to significantly improve Australia's health.
All right, and we expect a response from the government by the end of the year, and then some of these measures could in fact be implemented.
Absolutely. I mean, there's and some are already happening. There's no doubt about that, particularly with workplace programs, school and community programs. So things are really getting going, and we hope that by virtue of implementing this strategy, that, for example, in tobacco, that by 2020 there'll be 1 million fewer smokers in Australia.
And just to wrap up then, give us an idea, how dire is the situation with smoking and drinking and obesity and all of those health issues in Australia at the moment?
Well, those three things, in a sense, account for almost 30% of our diseases, or disease burden, if you like. Obesity is still going up amongst young kids, amongst adults as well. That's going to result in a pretty major increase in diabetes, which then results in major healthcare costs. Ask the police, ask the emergency department heads about the problems they see with alcohol, for example, just the pure diversion of resources, in a sense, away from other things that we could be sensibly spending our money on. And tobacco is still the #1 preventable killer in Australia.
All right, well, this is a good first step then. Professor Rob Moodie, thanks so much for joining us this afternoon.
Thanks, Jacinta.